My name is Sarah. I'm with Profi Fitness UK and I'm going to give you some information on outdoor fitness training for post-pregnancy. So to stay with me, I'm going to show you a PowerPoint and I'm going to talk through it while I do. So let's bring it up here. Ready to go. Okay, so here we have it, outdoor exercise for postnatal women with profifitness.co.uk. If you're already a trainer, then this will be a great addition to your knowledge. How to manage clients when you take them outdoors when they're post-pregnancy. You might find that others want to take part even if they're not post-pregnant, so that's a welcome side effect, a welcome hazard. Today I'll just go through a short presentation and give you some information that you can use as a trainer with your post-pregnant clients. So what do we have coming up in this short webinar? A little bit of feedback, a little bit of information from you would be great. So let us know if there's anything else that you'd like us to cover. For the moment, what's to come? We're going to go over screening and disclaimers. Very important that you screen your pregnant or post-pregnant client as a new client. And mostly we would like a screening done every day, verbally at least. If not written, you could do with a good disclaimer as well, some sort of written confirmation that the client post-pregnancy is understanding of the exercises they need to do and why they need to do them, and following your instruction to the letter. Next, we have locations and hazard assessments. So we're going to go through places that we can do these types of exercise with our clients and what kind of hazard assessments we're going to need to look at for these locations. Then we're going to have a look at how to use your surroundings, including the baby, to vary your programs. Lots of information there, bulk of the course or bulk of the webinar. A little bit on how we're going to use resistance bands. A great option for post-pregnancy, great for rebalancing the body, but also they are portable, so great for taking outdoors. Most important, incorporating core and pelvic floor to outdoor workouts. So what's always important for post-pregnancy is that we get some core activation and recovery, and the pelvic floor is healthy and monitored throughout the exercise. So high intensity exercise wouldn't be a great place to start. Jump jacks, anything with impact, we would possibly leave till a little bit later. So screening and disclaimer basics. As I said, we could do with a paper version at the start of your classes, absolutely, with your background information, your normal screening form plus more. And then we need a verbal screen at each lesson or each class. Whether you have one client or 20 clients in your class or in your training, verbal screen on a daily basis is essential post-pregnancy. In this screening form, you need to make sure that they have reached the safe time to exercise for them. So whether it be their 6-week post-pregnancy checkup with the doctor, or if they've had a cesarean section, it might take longer, up to 12 weeks, maybe more, before they can exercise, especially doing certain type of exercises. So this is something that's essential for you to find out which ones are have had a natural birth, which ones have had cesarean section. Very important bits of information there. So surgery and pregnancy complications as well. Did they have any surgery, including cesarean? Did they have any issues with stitches after pregnancy? Were there any pregnancy complications? So just leave them tell their story. This might be a good chat to have after your first class as well to get more information. They might be more willing to talk in a group, but you definitely need to get the essentials in before they start to exercise. So bearing in mind that your client might be a little bit more forthcoming once they get to know you, you could take it quite handy on the first session and build from there. So very, very basic, minimal exercise just to get them moving. Walking even would be wonderful for that. And I will mention it again later, but when you bring pregnant or post-pregnant clients walking, they may be used to using their pram or their buggy when walking. So the torque and the rotation in the core and the spine can be missing from their daily movements. So to incorporate that, maybe pushing the buggy with one hand, alternating sides, taking turns, not pushing the buggy as well would be a good option. Pelvic floor health, essential, absolutely essential. So we're talking about possibility of incontinence during exercise. Women may be too embarrassed to speak about this. When they realize everyone else is going through the same, it might change. But take it on assumption that there may be some pelvic floor instability or weakness. So that's your impact exercises again, to avoid those at the start, maybe gradually introduce and for limited amount of time, but also a little bit of pelvic floor education for them. So make them aware during exercise that they can contract and relax the pelvic floor. If they can't, then that's something that needs to be seen by a professional in pelvic floor health. A disclaimer signed after each session, before each session. What you're looking for there is a written piece. You choose the wording that is going to cover you in case of an accident. Now, as much as you'll do your best not to have an accident, being outdoors means there's more of a chance. So a client could stumble over something that's outdoors. They may, there's so many different things. They could slip on the type of flooring that's there, whether it's gravel or whatever you're using. Be careful just to make sure that if you're using a bench or a step, that it's stable. You test it first before the client does, and with care. In your disclaimer then, I, in my own, would put something along the lines of that if your clients don't follow your instruction as given, that they may be liable to injure themselves, and that you are not therefore liable for their inability to follow that instruction. Little things like that. Where it is also important is with post-pregnancy classes, you may have clients that bring other kids with them, and your main focus is not to babysit the other children, and you can get caught up with that. So if in your disclaimer you mention that children that are with the parent are under their own supervision, the parent's supervision solely, and that you're purely responsible for the activities of the adult, just to cover yourself in the case of something happening. As much as you'll try for it not to, as we said, these things are possible, and it's best to think of it before time. And closely observe during the class. So if it's a big group, split up the group so you can watch smaller numbers, but always watch the movements, especially when there's body weight involved or anything where there could be concern over posture, that kind of thing. Keep your observation of your clients, stay aware and monitor them for fatigue or being out of breath or anything that can change during the class. Blood pressure, possibly. Some clients may come to the class without eating. Little things can crop up, so you need to be aware all the time during these classes. So where can you exercise? You would be best to do a hazard assessment of the location that you choose, wherever it is. Very essential. Now that's going to change from day to day as well, so you can't avoid everything, but you control your controllables is what we're looking for here. As little risk as possible. So maybe your local park. I would have started my own classes in the local park. There's benches, there's steps, there's a bandstand, and for later on there's some bars that you can use. But again, much later when the clients have progressed you can look around for what's available to use as equipment. A walkway or a walking route. Don't underestimate the value in simply walking with your clients. First of all, as we said before, teaching them how to regain that torque and twist in their rotation of their spine and core with control, developing those muscles, very essential. Also, walking is a great exercise, but you're going to have the social aspect as well. So a huge part of it is social. A lot of women may not come to exercise at all. They might be there to meet others and get coaxed into perhaps getting toned up or losing weight or whatever it is that their goal is. A gym, car park, any of these places. So anywhere can be your location for outdoor exercise. Anywhere can be utilized. That's the beauty of it. Along with that, your numbers can be larger if the space is larger. It forces you to be a little bit creative sometimes in how you would run a class or how you would progress or regress an exercise. But once you assess the area, you can make a plan of what you'll use, what's beneficial and what areas you should avoid if there's any hazards or dangers. Anywhere is behind that picture there. So yeah, anywhere. So when you are in these places, we're going to use our surroundings. So lots of surroundings. First of all, baby, of course, you have a weight. You're carrying a weight with you in the pram or in your arms. Different clients will have different preferences. Some will baby wear in a proper baby carrier. Now, if they do, that's down to them to make sure that the baby is secure. So again, you might want to put that in your disclaimer. You wouldn't be a professional in baby wearing, so it would be best to make sure that they fully understand the risks of carrying a baby while exercising. Obviously, your view is impaired. There is obviously the risk of trip and fall, but again, once they're aware and once you're monitoring your class, it should be fine. Also, some exercises, like in the picture here, you can use the baby to sit on your lap for your sit-ups, although sit-ups probably not so early in the post-pregnancy. What this lady is doing here is her tricep dips. So once you have core control and you're not putting too much pressure on any separation that might be there, that exercise will be perfectly fine. What's great then is you can use the baby in the pram as well, or buggy. So huge benefit for this. You can play peekaboo with baby while you're doing your squats. Very entertaining for the toddlers and the small ones. So the pram can be used. It can be used as resistance as well. So you can use it as a hinge push-pull type of movement. You can use it for deadlift type movements. Anything mobility based, you can use the buggy or the pram, using the brake on it when you are using it in a static position and not placing too much weight, obviously, on the handles. Any of us who have buggies and babies have probably fell victim to putting too much weight on the back of those buggies at some point. So we want to avoid that during our classes. So advise your clients to lightly tip their hands on the back of the pram or the buggy to stabilize themselves, but not to place the weight on it if at all possible. This will encourage them then to work their stabilizer muscles and improve their balance as well. Huge benefit. Why not? Back to the baby wearing just shortly there. If the client is baby wearing, there are huge benefits, of course. The weight is going to be additional resistance. Having to maintain your body position while doing certain exercises will be more challenging. So some women who would be more fit might possibly prefer to use a baby carrier during exercises. If some clients decide, pardon me, that they want to use a baby wearer for classes, but they're not particularly fit, just get them to keep it low impact, low movement, on the spot, very little kind of excessive exercise. The weight alone, carrying it around, may be enough. As always, no matter what you're using, whether it's the baby for weight or whether it's your buggy, you want to make sure that you give safety points for your clients, how to use these things, how to use this area, etc. So this particular exercise I may not do with a client very early on. It's a plank using your buggy or your pram. There could be concerns over tipping the buggy, that kind of thing. Once your brake is on and you're using correct balance and you're putting the pressure on the right part of the buggy, shouldn't be a problem. But again, I would work up to this. Rather than necessarily placing all my body weight at an angle on the buggy, perhaps I would go to the knees and use the step at the front to do a push-up. That way then, if the buggy were to slide away, you wouldn't have as far to drop. Or planks again, same thing, but much closer to the ground and less body pressure. So we can use our surroundings wherever we are. So the curb, a step outside your door where you park the car, literally stepping up and down off of that is going to give the exercise that you would do normally or the walk you do normally that little bit extra. So use it. Why not? Steps, of course, different varying heights of steps can be used for, say, tricep dips, squats, step ups. If you're doing a step up, you want to make sure that the angle is no greater than 90 degrees and the full foot is used to push up to full stand. Again, you just want to be safe and secure in the knowledge that your client's feet are planted on the surface and they're not going to slip or fall. It can happen, it's just you want to reduce the likelihood as much as possible. Increasing exercise resistance can be quite easy then. Body weight is amazing for that. So like we're doing in the picture here, we have a tricep dip, but we're doing one leg. So we're actually increasing the resistance, increasing the amount of body weight that the person has to lift. So quite easy to progress body weight exercises with clients outdoors. And a bench, absolutely. Anything you can find is of huge benefit when you're outdoors. As I said, a wall in the list, even a wall sit or a wall squat is something you can incorporate if you have a flat wall outside a building. So it's about being creative. Another important part is the core and the pelvic floor. We mentioned the pelvic floor before. It is a canister, it is one unit. We have the diaphragm on the top, we have the abdominal wall at the front, the spine and the lower spinal fascia at the back, the glutes, but obviously the pelvic floor then as well. So that whole canister needs to function in unison well. So when we're talking about core, we're also including our pelvic floor. Simple things like breathing techniques during training. So teaching your client how to breathe again, simple little things that may seem obvious, may need to be retrained. You can use the hand to help with neural input or sensory input. So getting the client to place their hand on their stomach and asking them to expand their stomach when they breathe in and pull it, exhale and flatten the stomach again. You have your own methods for teaching, but what's important is it may need to be retrained again. Simple things like inhalation and exhalation while exercising, maintaining that intra-abdominal pressure during exercise. So inhaling or exhaling, pardon me, on the effort. So inhale and exhale on the effort. We normally take a 4-2 pattern for exercise. So inhale for 4 and exhale for 2 while having the effort. Okay, so low impact pelvic floor conscious exercises. Like we said before, we don't want anything too high impact. We don't want to put too much pressure on the pelvic floor. We don't want to cause any leakage issues. We do want to work with that pelvic floor, make them pelvic floor conscious. So little things like glute squeezes, Pelvic tilts can be added to small movements like, okay, we're going to go up onto our toes, toe raises, and now we're going to add toe raise into pelvic tilt. Teach them how to contract, but also how to relax the pelvic floor. Bear in mind then, I suppose, when you're choosing your location, somewhere with an outdoor toilet facility might be useful, because we do have an awful lot of pressure on that pelvic floor area post-pregnancy, and the bladder can feel full at times. We want to focus on simple movements to stabilize the core. So rotation or torque when walking, making sure we have that natural movement in the spine and the hips that we may have lost during pregnancy. Then we want some low resistance unilateral exercises. So if you force the body to rebalance again, we have a lot of postural issues post-pregnancy, potential postural issues. The resistance unilaterally will help. So we want to have it low. We can build on it then. We can use resistance bands for that and body weight. So resistance bands, they are great for taking with you on the go. Also really good for restabilizing or rebalancing those muscles. So they're lightweight and portable. Can't get any easier to manage than that. They help build strength, so you have varying degrees of intensity or resistance that you can build up through for your clients. Rebalance body posture, so you're using your resistance training to improve the strength in muscles that have been weakened during pregnancy and pregnancy posture. Also, then you can use them for stretching. Post-pregnancy exercises to help rebalance the body in the stretching side, or things that need to be lengthened again that have been tight. So types of exercises you could do. For my own classes, what I would have done is used a pole from a bandstand, so it could be like a light pole, and put the band around the pole, holding it on either side, being able to do upper back exercises, upright row, keeping the elbows nice and high, shoulders down low, and rowing high to hit in between the rhomboids and the traps in there. Then you can go a bit lower with the row, working the whole way down through that spine that's after being weakened and compromised during pregnancy. Also, then you can do your put the bands around your thighs and do your hip mobility movements. Simple little things like side steps, leg raises, just like in the picture, rear kicks. Simple things can be absolutely hugely beneficial for women. Then you want to have a look at rotation. So holding the band in a position, maybe about around that pole again, and locking the body and rotating through the core, spine and hips. Lots of options there. What's also very important when we're training with post-pregnant clients is balance. So balance will be compromised. So again, that unilateral exercise will help, but you can do simple things like balancing exercises, standing on one leg, trying to get them to engage the full body to maintain stability, to stand there for an increasing amount of time. And then you can also move off the center. So using the opposite leg to create an imbalance to try and force the stabilization in the muscles. Flexibility then, be aware of relaxin. Apologies, that was an autocorrect there. Relaxin is the hormone that's released in the body when you're pregnant to allow for flexibility in the joints, to allow for birth. So that doesn't go away overnight. It can stay in the body for quite a while. So there can be a laxity in the joints for people, and they may be in a position that they'll overstretch. So just to be aware of it, keep the stretches within range. Don't force flexibility during the first months after pregnancy, at least. Up to 12 months, it can still be in the system. So it's better safe than sorry. You can work on mobility exercises rather than improving or increasing flexibility. Just stay within that range that you are in discomfort rather than pain. Another one then, postnatal depression. very prominent. A lot of women have and don't speak of it. So these exercise sessions can be massively beneficial to those women. So you might have clients who come along and they don't want to exercise. They're purely happy to be in the company of other women. You really need to read your clients, give them what they need. Also, don't underestimate them, because we tend to try and wrap women in bubble wrap as well. We're a little bit overcautious, especially if we've not been pregnant ourselves. The awareness isn't there of what exactly they're going through. So we tend to be a little bit over careful and may go against something our client would say. Like, they might think they can do something. We might patronize them in a way by saying, we don't think you can. Compromise. If it's something that can be work towards it with them. Be careful, but also be aware that they are lifting that baby day in, day out, moving the car seat, lifting prams, all that. So you teaching them how to do it safely rather than telling them not to would be the best course of action. Fatigue, breastfeeding, all post-pregnancy discomforts, just to be aware of them, because little things, breastfeeding women or post-pregnant women, they might have breast tenderness. So running or impact again might be uncomfortable for the breast. They might need to stop and breastfeed a child. So you need to be aware of all these little things, just so if it crops up, you're not caught unawares. Push-ups, that kind of thing as well, can be a little bit uncomfortable for women who are breastfeeding or have chest discomfort. Now, when we speak about push-ups, if we haven't done them for a while and we do them correctly, we're going to have that tenderness, discomfort in under the armpit, in that breast tissue. So again, awareness of what's normal, what's pain, what's discomfort, what's exercise related. It'll come with time, so build the exercise as you go. And as I said before, the social aspect is essential. So what I found absolutely optimal for my classes with pregnant women or post-pregnant women was having a coffee morning or a walk and a talk every now and again, just to leave them speak about themselves, their experiences. Women sometimes go through so much they don't want to repeat it again for a while. They don't want to talk about it. Maybe they have spoken about it so much they feel nobody wants to listen anymore. And it's always beneficial to have someone else who's been through it, who you can relate to, who can relate to you. All of that is shared knowledge and shared experience and helps everybody in this situation. So don't forget the social aspect. And I think that's it. Yeah. Okay. So coming back to you before I go, if there are any questions, this was just a short intro on how to take your post-pregnant clients outdoors for training. Some tips, some tricks, some advice, anything that you'd like to know, please send us in some questions. We'd be delighted to answer it. My name is Sara Hearne. As I said before, I work for Profi UK and Profi Ireland, and I am on Instagram and Facebook, Sara Hearne Fitness. So if you have any questions, send them into Profi or me, and I'll answer them